Next up is preserving your teeth. More than 65% of the U.S. population over the age 65 have periodontitis. The word is derived from the Greek peri, meaning around, odont, meaning tooth, and itis, meaning disease. Periodontal disease is an affliction of the tissue surrounding and supporting our teeth and a major cause of tooth loss. Poor diet quality is associated with oral health problems such as periodontitis and tooth loss, and the relationship may be bidirectional. For example, there's a pro-inflammatory food component, saturated fat, could be contributing directly to tooth loss, or tooth loss could be contributing to eating more fatty foods like processed meat because they're easier to chew. In the same vein, the foods associated with fewer missing teeth, fruits and vegetables, are both anti-inflammatory and may require more chewing. Is a poor diet leading to poor dentition leading to a poor diet, or both? Long in the tooth. As we grow older, we already tend to eat less and eat less healthfully. Between the ages of 40 and 70, food intake drops by about a quarter due to a declining appetite. We also start losing our taste buds, and sweet and salty tastes are often the first to slip. This can lead to diets particularly excessive in sugar and salt. Throw in a shift to pre-processed foods due to poor dentition, you can imagine how this could kick off a vicious cycle, though longitudinal studies don't present clear evidence that tooth loss indeed leads to a loss in nutritional status. However, tooth loss is associated with premature death and dementia. A systematic review and meta-analysis found that both periodontitis and tooth loss are predictors of a shortened lifespan. Not all studies accounted for confounding factors such as smoking, which could easily increase the risk of both, but those that did control for these other considerations still found missing teeth to be associated with premature death. Dentition could just be a surrogate for overall health status or genetic robustness. For example, centenarians have better oral health than those in the same generation who died 40 years previously, and so do the children of centenarians compared to their same-age peers. There is, however, a potential causal pathway by which periodontal disease could cut a life short. Periodontitis is a chronic inflammatory bacterial disease that leads to the destruction of tooth-supporting structures, such as gums and underlying ligaments and bone. These bacterial pathogens can invade the bloodstream and trigger a systemic inflammatory burden. This could explain the association between missing even just a few teeth and the elevated risk of heart attacks, as well as connections between periodontal disease and other signs of vascular inflammation, such as erectile dysfunction. By looking in your mouth, your dentist may find out more about you than you realize. Does that explain the dementia link as well? Indentured conservant. Systematic reviews and meta-analyses have found that tooth loss, or periodontitis, is associated with both cognitive impairment and dementia. Reverse causation might be an intuitive explanation, dementia leading to a decline in oral hygiene, but prospective studies following people over time have found that tooth loss appears to predict future cognitive decline, and the more missing teeth, the higher the associated risk. I detail a fascinating series of experiments in c.nf/overdentures, where, for example, in a study entitled New Teeth for a Brighter Brain, researchers found that replacing missing molars with crowns affects the size of your pupils, suggesting that a gap in the sensation of teeth pushing against each other adversely affects brain function. If you think that's wild, check out this one. 10 toothless individuals, 9 out of 10 of them cognitively impaired, 6 severely so, were given conventional dentures for a month before being fitted with overdentures, which are snapped onto titanium implants surgically screwed into the jawbone. The conventional dentures, held in place by adhesives and natural suction, did nothing to significantly alter cognitive function, but the ones securely attached to implants in the bone appeared to have a dramatic effect. The overdentures presumably transmitted the same kind of chewing pressure sensations to nerves in the jaw that the natural roots of teeth might. 9 out of 10 of the subjects went into the study cognitively impaired, but 8 out of 10 left the study cognitively intact. This suggests that well-fitting, secure dental prostheses aren't just about improving self-confidence, social contact, quality of life, but proper brain functioning as well. Even better, though, is to preserve the teeth you have. A sidebar: building a better mouthwash. If tooth decay is a bacterial disease, why not just use antibiotics to kill the cavity-causing bugs? Many such attempts have been made. However, undesirable side effects such as antibiotic resistance, vomiting, diarrhea, and teeth staining have precluded their use. There are antiseptic mouthwashes with chemicals like chlorhexidine, which is considered to be the gold standard anti-plaque agent, but as I show in c.nf/mouthwash, there's a cheaper, safer, better option using green tea as a mouthwash with or without added amla. Don't sugarcoat it. Our ancestors, who lived more than 10,000 years before the toothbrush was invented, had almost no cavities. Why? Because candy bars hadn't been invented yet either. Now, dental cavities may be humanity's most prevalent disease, and as I show in c.nf/sugar, sugar consumption is considered to be the one and only cause. The recommended 3% cap on total daily intake of added sugars wouldn't even allow for a single average serving for young children of any of the top 10 breakfast cereals most heavily advertised to them. Obviously, soda's off the table. One can would be nearly 2 days' worth of sugar. The official position of the American Academy of Pediatric Dentistry was that frequent consumption of sugary drinks can be a significant factor in the initiation and progression of dental cavities. That is, it was the official position before it accepted a $1 million grant from Coca-Cola. After the grant, its tune changed to, quote, "Scientific evidence is certainly not clear on the exact role that soft drinks play," unquote. As the Center for Science and the Public Interest Integrity in Science Project put it, what a difference $1 million makes. If we were really interested in minimizing disease, the ideal goal would be to drop the intake of added sugars to zero. Though that may be able to get rid of cavities, wrote a Kellogg's-funded researcher, quote, "This ideal is impractical," unquote. The, quote, "dictatorial use of foods friendly to the teeth might promote dietary celibacy, not acceptable to all individuals." Rather than recommending, quote-unquote, draconian reductions in sugar intake, the sugar industry responded that, quote, "attention would be better focused on fluoride toothpaste," unquote. That's the perfect metaphor for medicine's approach to lifestyle diseases. Why treat the cause when you can just treat the consequence? A sidebar: are dental x-rays safe? Every year, doctors may cause an estimated 29,000 cancers by dosing patients with x-rays during CT scans. What about dentists? Dental x-rays are the most common artificial source of contact with high-energy radiation, subjecting tens of millions of Americans a year to exposure. Don't the lead apron and thyroid or neck shield protect your vital organs? All your vital organs except for one, your brain. As I detail in c.nf/dental x-rays, without a hyphen, dental x-rays appear to increase the risk of the most common type of brain tumor. There's little evidence to support irradiating asymptomatic patients in search of problems hiding in their mouths. Accordingly, dentists should only take x-rays when there's a patient-specific reason to believe there's a reasonable expectation the imaging will offer unique information that will influence diagnosis or treatment. Tooth-preserving diet. What is the role of diet in periodontal disease? I review the evidence in c.nf/periodontitis, including interventional studies showing that the superior periodontal health among vegetarians may be due to eating fewer pro-inflammatory foods or more anti-inflammatory components like high-fiber diets. As I detail in c.nf/chewing, there was even a remarkable trial in which more than 1,000 participants were randomized to decades of a healthy dietary intervention practically from birth. Those in the lower saturated fat and cholesterol arm ended up with better saliva flow, which is essential for the maintenance of oral health. This is thought to be a function of greater chewing required of fiber-rich foods. Similarly, foods requiring more intensive chewing have been found more effective at improving bad breath. A sidebar: brush with greatness. Surprisingly, as I review in c.nf/flossing, the evidence is limited that adding flossing to a brushing regimen reduces gum inflammation, but it's still recommended on a daily basis. Researchers have compared unwaxed to woven to shred-resistant floss, and they all appear to have about the same plaque removal efficacy. Should you floss before or after you brush? A randomized controlled trial on flossing sequence was performed to put to rest dueling intuitions. Flossing first won, hands down. Greens for gums. When researchers took advantage of a Survivor-type reality TV show in which contestants agreed to live under Stone Age conditions to study the natural progression of dental disease without toothbrushing, they were surprised to find a lack of gingivitis. Normally, as I review in c.nf/plaque, plaque buildup is followed by gum inflammation, but perhaps this is only in the context of eating a lot of processed foods rich in sugar and low in anti-inflammatory whole plant foods. Randomized, double-blind, placebo-controlled trials of the amount of lycopene in as little as 1 tomato a day, equivalent to about a daily tablespoon of tomato paste, found a significant reduction in gingivitis within just 1 week, as well as an improvement in gum bleeding in chronic periodontitis patients. However, half the dose didn't appear to help, so it looks like you have to go the whole tomato. A few plants, namely greens and beets, have another secret weapon, nitrates. Beyond improving circulation, nitrates may also play an important antimicrobial role in our saliva, proven in a randomized, double-blind, placebo-controlled clinical trial to alleviate gum inflammation. Check out c.nf/chewing for the full story. Another sidebar, oil pulling my leg? Coconut oil is safe to put on your hair and your skin, but according to the American Heart Association and the American College of Cardiology, you don't want to be eating it. In fact, you may not even want to be in the same kitchen when coconut oil is being heated. I don't know where people got the idea that it's safe to use for cooking. Coconut oil has one of the lowest smoke points and releases a variety of toxic emissions at typical frying temperatures. What about just swishing coconut oil around in your mouth? I have a 4-part video series starting with c.nf/oil pulling on a time-honored folk remedy that involves quote-unquote pulling oil back and forth between the teeth for minutes before spitting it out for a variety of purported quote oral and systemic health benefits unquote. There appears to be no such systemic benefits, and the effects on oral health are mixed, good, bad, and neutral. The reason to avoid it completely is the very real risk of lipoid pneumonia, a potential consequence of aspirating small amounts of any oily substance into the lung. In fact, the reason some of the dental studies were performed on, quote, a stored collection of human-extracted teeth, sounds straight out of a horror movie, instead of on real-life subjects, is that the researchers considered it, quote, not ethically sound to conduct a human trial of oil pulling with the knowledge that there was a chance of inducing lipoid pneumonia in study volunteers, unquote. Don't end on a sour note. A meta-analysis of 18 studies on the oral health implications of vegetarian diets showed that vegetarians have significantly fewer decayed, missing, and filled teeth. This isn't surprising given that vegetarians eat more antioxidants and anti-inflammatory foods. Those eating plant-based also have significantly lower rates of oral cancer in every study to date on the topic, leading to a review on oral cancer prevention published in the Journal of the American Dental Association to conclude, quote, evidence supports a recommendation of a diet rich in fruits and vegetables as part of a whole foods plant-based diet, unquote. Vegetarians do appear to have an Achilles tooth, though, an increased risk of dental enamel erosion thought to be due to their consumption of more acidic fruits and vegetables such as citrus and tomatoes. As I cover in c.nf/sour, the solution is to rinse out your mouth with water after consuming sour foods or beverages, and waiting to brush your teeth for at least 30 and preferably 60 minutes after consumption to allow your teeth to first remineralize so as not to brush them in a softened state. Sidebar, is fluoride safe and effective? One of the studies that bucked the trend and showed that vegetarians had more cavities blamed the excess decay on the fact that vegetarians were significantly less likely to choose fluoride-containing toothpaste, which has clearly been shown to reduce tooth decay. Adding fluoride to drinking water is more controversial, though characterized by the CDC as one of the top 10 public health achievements of the 20th century. Growing evidence about the adverse effects of fluoride on brain development led the National Toxicology Program's draft conclusion that fluoride should now be, quote, presumed to be a cognitive neurodevelopmental hazard to humans, unquote. Ironically, it was the anti-fluoridationists who were accused of their quote-unquote anti-scientific attitudes, but now it's the pro-fluoridationists who may be ignoring evidence that doesn't conform to their beliefs. How can society get the cavity-preventing benefits of fluoride without the risks? Since the primary risk arises from systemic absorption, yet the primary benefits arise from topical contact with our enamel, we can safely reap the rewards by using fluoride toothpaste and mouthwash. For an in-depth look into why I changed my mind on water fluoridation, see my 5-part video series starting with c.nf/fluoride.